Are there laser alternatives for darker skin?
Laser-based skin rejuvenation can yield substantial improvements in skin texture and quality, effectively addressing common issues like wrinkles, dullness, age-related discolorations, and skin laxity. However, these same laser treatments can be problematic for skin types prone to hyperpigmentation or darkening of the skin after inflammation. Although we perform procedures such as laser hair removal for all skin types, laser procedures for skin rejuvenation, often used for people with lighter skin, may not be suitable for olive to darker skin types. There are, however, very effective options, several of which I've developed and customized in my practice. I'm Dr. Amiya Prasad. I'm a diplomate of the American Board of Cosmetic Surgery and a fellowship-trained oculofacial plastic and reconstructive surgeon. I've been in practice in New York City and Long Island for over 25 years. The fundamental goal of skin rejuvenation technology is centered on triggering the body's generation of collagen, an essential protein critical for skin strength, integrity, smoothness, suppleness, and a youthful appearance. Collagen induction therapies include different lasers and microneedling procedures. They employ a controlled injury approach to specific treatment areas. This injury initiates the body's healing response, leading to enhanced collagen production in these treated areas. Although these principles can be applied to people with darker skin types, there are some risks to be aware of. Darker skin types are more susceptible to keloid scarring, such as raised scars seen after surgical incisions heal. Furthermore, they may experience hyperpigmentation or darkened skin in laser or microneedling treated areas, as well as hypopigmentation, which is the loss of pigmentation leading to an uneven skin tone. Early in my career, I was a division chief at a level 1 trauma center serving a majority African American population. I also was performing a lot of cosmetic eyelid surgery for non-Caucasian patients, including African Americans, Asians, Middle Eastern, South Asian, and Latinx backgrounds. I adapted my approach to cosmetic eyelid surgery to optimize results, factoring in the unique skin and bone structure characteristics across diverse ethnic backgrounds. Drawing from my experience, I authored the article Ethnic Considerations in Eyelid Surgery, which was a publication that led the way in its time. Lasers commonly used in lighter skin types, such as fractional CO2 and erbium lasers, pose an increased risk of hyperpigmentation in darker skin. It's worth noting that overexposure or excessive heat from these lasers can also result in hyperpigmentation in individuals with lighter skin as well. Microneedling, even a mild treatment, may cause hyperpigmentation in dark skin, and individuals with lighter skin may also experience similar issues with overly aggressive treatment. This means that for skin rejuvenation in darker skin types, the strategy should involve treating the skin's surface with minimal trauma while simultaneously targeting internal skin treatment to stimulate collagen production. Radiofrequency devices such as Pelivay use heat to trigger an internal collagen production response. Despite their surface application, these devices' energy penetrates beneath the skin without compromising the surface of the skin. This heat delivery to the dermis, the backbone of the skin, promotes the production and strengthening of collagen fibers, thereby enhancing skin strength and firmness. An approach applicable to all skin types involves utilizing the Renuvion device, which similarly employs radiofrequency technology. Renuvion uses helium plasma, targeting collagen fibers beneath the skin, further reinforcing and tightening the skin from inside without heating the skin surface. For example, I employ Renuvion extensively for neck skin tightening and contouring across all skin types without any pigment-related issues occurring in people with darker skin. Platelet-rich plasma and its thicker form, platelet-rich fibrin matrix, are non-heat-based collagen induction therapies suitable for all skin types. PRP and PRF use the healing and growth factors naturally found in a patient's blood, similar to those aiding injury recovery, like a cut in your skin. These factors are concentrated in a centrifuge and, when applied, prompts a collagen response as well as improvement in blood supply to the treated area, resulting in the improvement in texture and glow to your skin. In addition to skin rejuvenation, I also routinely use PRP when performing procedures such as laser skin resurfacing and cosmetic eyelid surgery. PRP can also be combined with hyaluronic acid to improve skin quality and skin hydration. We do this by using a delivery device with microscopic infusion technology to deliver a combination of PRP and hyaluronic acid directly to the dermis without any obvious marks in the skin. This is in contrast to typical microneedling, where the skin is intentionally traumatized with clusters of oscillating needles. Until recently, medical aesthetics was the domain of trained cosmetic and plastic surgeons as well as dermatologists. In the current environment, the lack of regulation enables almost anyone to offer aesthetic medical services. These less regulated providers lack the comprehensive knowledge and experience obtained through an MD's residency and fellowship training. In the past, devices like lasers were initially introduced to MD-level specialists for assessment before being accepted for general use. However, there's been a shift. Device companies now market directly to the public, allowing widespread access of aesthetic procedures performed by less than ideal providers. This reckless commercialization understates the risks of irreversible damage to your skin, deceptively likening a medical device-based treatment to be comparable to a routine visit to a hairstylist. It is vital to understand that devices such as lasers, radiofrequency, or other thermal energy devices are tools which are best applied by qualified specialists. The device itself doesn't independently dictate outcomes or avoid complications. Understanding this principle is particularly important for people with darker skin who have a higher risk for complications. I hope you found this information from my experience helpful. If you're interested in recommendations for your individual situation, you may contact us through our websites or call our offices to schedule a consultation. Thank you.